here with the Kettering Health Hamilton ER team, Chloe, Joey, and Ellie. It sounds like a band. I don't know. It's some good names. Actually, they're a really cool group. So tell me about your poster that y'all did. What'd y'all choose?
We chose the Soft Wait Restraint.
Okay.
We are doing this to prevent falls and promote safety in our ER.
Yeah, it also helps with a lot of our altered patients. Obviously, we don't just see confused elderly patients, so this kind of helps with our intoxication of some sort patients as well, which keeps us safe too. So we're not trying to catch people jumping out of bed.
So for those who don't know, what the heck is a gait belt? What does it do?
So it's basically almost like a seatbelt that goes around the waist that we quick release not to the bed. So they still have function of their like limbs and stuff. So we're reducing injury on the wrists and ankles that sometimes we see because they're usually trying to move and try to get out. So it's basically a seatbelt.
Okay, that's cool. So what was the problem that you all came up with? How did you all identify this as the project you all chose?
So we've kind of been looking for an idea like this for a while, and we didn't really know in the ED that we had these. I guess we've had them in the hospital for years, and in the 6.5 years I've been here, and Joey's been here longer, we have not seen them used, so we decided to bring them down to the ED and teach our staff about them, because we do end up putting a lot of patients in restraints, unfortunately, but this is a much less invasive, less restrictive alternative.
Okay, so what did you learn as a result of implementing this?
Well, we're still kind of watching outcomes right now. This is kind of new for us, but so far so good. It's promoting safety. We're able to do this more often. We have them stocked in our part room now, so we're still watching outcomes, but so far it's been so good, I feel like.
Yeah, we've been able to decrease violent restraints, which has been helpful, and limb restraints in general, which was our goal. So we've seen at least a 10% decrease, not increase, decrease.
What impact do you think it has on patient care?
I actually think the patients are more satisfied. I've talked with family members, and they prefer this option to tying down grandma's wrists a lot more because they still have that freedom. And a lot of our confused patients don't even realize they have the seatbelt on.
Yeah.
So it's actually been, I think, an increase in patient satisfaction and family satisfaction as well.
But it still keeps the patient safe, but also you all safe as well. It's not trying to dive after the individual who's jackrabbiting or trying to get out of bed or doing stuff.
Exactly.
Well, what a great project. What advice would you give to somebody who's thinking about doing their first clinical ladder project? What advice would you give him or her?
Have a good mentor.
Okay.
Shanita was great.
So have a good mentor. How about you, Chloe?
Also, just have a good team to work with.
Okay. It's who you work with. Good team.
I would say find something measurable, something you can implement and watch outcomes and watch numbers just to see if it's actually working.
Well, if you see Chloe, Joey, and Ellie, I just don't know why. It just sounds good to say it in that order. If you see them out in the ER, give them a congratulations. Ask them how their project's going. Well done, you all. What a great project and what an impact it's going to have and is already having on patients. Proud of you all.
Thank you.
Thank you.